Now, narcissists can wear you out. And the more extreme and severe it is, the more folks are likely to just be like, just say yes to him or her. Hi, and let's talk about the 3 most common misunderstanding or misconceptions of narcissism. Now, the first one, this is that all narcissists are the same. That this narcissist is the same as that narcissist, and they're all the same. So if you grouped them all in a big concert hall, they would all have the same degree and engage in the same types of behaviors, and they're all narcissists. Well, when we look at it that way, we know that that is absolutely not true. Now remember, narcissism or narcissistic personality disorder, which would be sort of the full clinical pathological identifier for narcissism. Some folks have narcissistic traits, and some folks meet the criteria for narcissistic personality disorder. Now, those who meet criteria for narcissistic personality disorder, it's going to be more severe, it's going to be more challenging. And they are going to certainly present in a very, very different way. They're going to be more wedded to a lot of those maladaptive beliefs, behaviors, and patterns that fill their ego, that give them this sense of safety through making others feel bad, manipulating others, maybe making them feel as though they're always uncertain or unsteady. Because the goal of the narcissist, and again, we're going to generalize, but this is to different degrees. And I see this in therapy too, is that they're always trying to have a sense of power and control so they can feel safe. Because underlying all of that narcissism is typically fear, shame, doubt, guilt, and inferiority. And all of those things manifest in that individual to varying degrees. So some folks are going to present with severe narcissism, that's all the way, or extreme narcissism, that's all the way. And then some folks are going to have some narcissistic traits, some narcissistic behaviors and views, and that's probably more of a mild sense. Now, in relationships, how does this manifest? Again, it depends upon the severity of the narcissism. And the key in this video, what we want to talk about, is recognize that all narcissists are not the same. And I think now the term narcissist has become almost colloquial to the point that anyone who mistreats us, or if we have a bad relationship or they do something selfish, then they're a narcissist. And when we hear narcissist, we equate it with narcissistic personality disorder. However, you can just be a narcissist and not have the full personality disorder, which means that you wouldn't meet these criteria. And if you don't meet the necessary criteria to qualify for narcissistic personality disorder, then that's actually better. That's a better prognosis, because those that meet criteria for narcissistic personality disorder have set up a pattern and a feedback loop in their life that supports their views that they're better than everyone else, that supports their perspective and their behaviors, whether directly or indirectly, that they can feel good about manipulating others, making them feel small, making them feel uncertain about themselves, and they find folks that are kind of, lack of a better word, okay, and sometimes it's unconscious, but are willing to accept, I think I like that better, willing to accept being that step down, having that lower sense of value compared to the narcissist. Now, narcissists can wear you out. And the more extreme and severe it is, the more folks are likely to just be like, just say yes to him or her. Just say yes, it's better than getting into it and all that. And that comes out of a search for enlisting people in their life. So a lot of narcissists will use enlistment. And I have a video on that. I'll put it here if you want to check it out. That they enlist particular people who are willing, consciously or unconsciously, to be okay with being that step down. So they're able to then fill their interpersonal circle with folks who directly or indirectly support the narcissism. It's not about blame. It's not about, oh, they should do this, they should. It's not what that's about. All we're looking at is the narcissistic individual and their interpersonal circle. Now let's talk about number 2, is that all narcissists are grandiose. That's absolutely not true. There are 2 subtypes. The first is kind of that classic narcissist. I like to think of this, if you've seen the movie Wolf of Wall Street, that is definitely an extreme, grandiose narcissist, without a doubt. And he meets all of the criteria. So that's the classic. Now, what we don't expect is vulnerable or covert narcissism. And what that individual presents like is that they often present as very hurt. They'll talk about kind of their weaknesses and struggles and pain. And we don't expect that from a narcissist. So a lot of therapists don't see the narcissism initially because they present in a very vulnerable fashion. And we're stuck with the classic idea that narcissists are this grandiose Wolf of Wall Street type of person. It's not true. Because what happens is the vulnerable individual, they've incurred a narcissistic wound. And when I say vulnerable individual, I'm going to step back for a second, because what I mean is that vulnerable presentation in the narcissist. Because individuals along the narcissistic spectrum, the more severe it is, we talked about number one, remember, that degree, the more severe the narcissism is, and if they qualify for narcissistic personality disorder, they will display these two types, grandiose, that classic, or vulnerable, depending on what's going on in their life and if they've incurred what's called a narcissistic wound. That narcissistic wound is something's happened, someone of high status has said something, and they've internalized it, and it hurts their sense of self. It really gets to what I call their core content of shame, guilt, doubt, inferiority. And we see that then that narcissistic wound sort of festers, right? It's like any wound that isn't treated, it festers. And the narcissist is going to try to balance that or remedy that by engaging in either internal, which is that you get depressed, you feel low about yourself, you feel broken, that vulnerable sense, or you try to manage it through trying to destroy that object that has caused a narcissistic wound. Now, destroy doesn't mean kill that person or anything like that, even though narcissists, a higher degree of severity or greater likelihood to commit murder or certainly engage in domestic violence behavior. But what they do is then they will try to destroy that person, which could be their reputation, could be financial, whatever it may be, to lower that person so that they, the narcissist, has this sense, this greater sense of restoring their sense of self. So what happens in therapy is you have this vulnerable type comes in because they've incurred this narcissistic wound. They're talking about their pain. They're talking about their loss, talking about their suffering. And so they're working with the therapist. Then as that wound starts to get treated and the narcissism starts to sort of balance out, then more grandiose traits start to come out. More grandiose perspectives, beliefs, behaviors, and patterns start to come out. And then the therapist is like, oh my God, this person qualifies for narcissistic personality disorder. That's usually the therapeutic surprise, right? That now you're working with someone along the narcissistic spectrum, because we don't expect that, because we only believe that narcissism is one type, which is the grandiose type, but it's not. There are two central components, grandiose and vulnerable. So we got to keep an eye out for those. And everybody can show them again to varying degrees. So all of these are related. Last, and this is the most tricky, is narcissism incurable? And my direct answer is no. It is Now, let me explain this. So in working with anyone with any type of mental health condition, it's not about curing the disorder, right? I mean, think about when you go to the doctor and you don't feel well, you feel kind of yucky, stuff like that, and they find out that it's a bacterial issue, and they give you an antibiotic, and then you take it for a few days, and it's gone. Does that mean you'll never have another bacterial infection that will make you feel bad where you'll have to go to the doctor? Probably not. And it's the same thing with mental health, but people hold this idea that going to mental health, that going to a psychologist, a therapist, whatever, you go to see them, and you're going to see them to get rid of that depression, anxiety, trauma, whatever it may be, personality disorder issues, gone forever. And it'll never, ever come back. That isn't the case. Because what happens is that individuals with personality disorders, and we're talking about narcissistic personality disorder, so we'll focus specifically on that. What we want to do is that these particular personality disorders, the narcissistic personality disorder, that they have developed this very eloquent, not fancy and nice, but eloquent, meaning obviously that it's very involved, it's a very sophisticated, organized, maladaptive response system. When they incur some stress, they incur some fear, whatever it may be, and it activates what I call that core content. It activates their core content of fear, shame, guilt, doubt, or inferiority, and that causes them to engage in surface content behaviors. Now, those with personality disorder, narcissistic personality disorder, they engage in narcissistic, maladaptive beliefs, behaviors, and patterns in order to manage that core content activation. Now, I've worked with folks with narcissistic personality disorder, and what we do is we identify those areas, those maladaptive patterns. Then what we do is we work to understand them, understand how they're connected to core content, because a lot of times that response pattern is like that, right? When you get in a situation and you feel overwhelmed and something is happening in a hurry, are you like, wait a minute, let me use this behavioral or cognitive response because this will have the best outcome? No, you don't. Well, your narcissistic personality disorder individual doesn't either, because what they do is that core content gets activated and man, they just immediately go to those maladaptive beliefs, behaviors, and patterns to try to resolve the situation. Problem is that they're maladaptive. So they hurt those around them. They put most relationships at risk. They are trying to get that sense of dominance where they feel safe. So it's all of this complexity. So what we do is we go from maladaptive response to adaptive beliefs, behaviors, and patterns. And what you see is that instead of using maladaptive responses, now you're using adaptive responses to manage the situation. For example, let's say you come home and something's funny or funky, right? And the person who comes home and has narcissistic personality disorder. And it's funny or funky, right? Things are just out of place. And that makes you feel like unsafe. And unsafe meaning that is that person cheating on you? Is that person then saying things about you? That can activate that core content. So what you do, the maladaptive response, is to then accuse that person. You're cheating on me. You're doing this. You have low value. You're this, calling all kinds of names, causing all kinds of problems. Could even end up in physical violence, things of that nature. That's that maladaptive response. Now, let's talk about the same scenario, but we're going to use adaptive response. That same person comes home, same kind of thing is a little weird. The adaptive response is you feel that sense of activation, right? You feel that core content activation. Then you're like, wait, something seems weird. You ask your partner. You ask that person, something seems weird. Something seems off. Do you feel that? What is that? It feels kind of strange. And now you're having an adult, calm dialogue about your fear, about your concern, and you're addressing it. And if whatever they say still seems weird, you're still discussing it to solve the problem. And that's, in essence, what we're doing. We're going from maladaptive response to adaptive response. And just like any skill and any kind of habit or habitual response, the more you engage in adaptive behavior response when your core content is activated, the less maladaptive, narcissistic beliefs, behaviors, and patterns that will disrupt your life and the life of other people in your life. But that person has to be willing, that person who came home and saw things are kind of in disarray, that person has to be willing and driven to do things differently. Partners, family members can't force them to do it. They can't mandate them for therapy because it is a hard, frightening process. And it's difficult, but not impossible. So I hope you found these 3 helpful. Please leave comments and like, share, and subscribe. Comment, hit that bell, and I'll see you next time. Thanks a lot. Bye-bye.